Hey everyone, this is Dr. Rao from Pain and Spine Specialists as well as Shakti Health and Wellness Center. I get asked often what we do that's slightly different than perhaps other practices, or how do we incorporate integrative medicine, regenerative medicine into what we would say is traditional pain management. Now, traditional pain management is treating pain through a conservative approach. So physical therapy, chiropractic therapy is your first line of treatment, Tylenol, anti-inflammatory medications if you can, topical patches or creams. And if that doesn't work, then we start looking a little deeper to figure out what's going on. Do we need to consider other types of medications, different types of specific classes of medications? Do we need to look for what's causing the underlying problem? Is that require an x-ray, a CAT scan, an MRI? Or do we need to go further and perform some type of procedures or injections to try to get to the source of the problem, get that to get better so you feel better? Or do we need to start getting more minimally invasive and perform different types of procedures to get to the source to anatomically fix something, or put a device in to block the transmission of pain to the brain or change how the brain perceives the pain? So these are all what I would consider conservative, traditional pain management techniques. Now, we want to be as conservative as possible. Our goal at Pain and Spine Specialists is to do the least that we have to do to maximize your outcome. So how do we do that? Well, first we take a thorough history, we do a physical exam, and we try to figure out where the problem's coming from. We also want to make sure you've exhausted more conservative or traditional treatments, less invasive options before we start moving further down the pipe. If the conservative treatments have either been tried or failed, or sometimes there's so much pain that sending you to physical therapy may just not be the right next step. We want to get that inflammation to subside. We may want to consider oral steroids, anti-inflammatory medications, muscle relaxants, topical pain creams or patches, nerve pain medications, opioids, and or injections to try to get to the source of the problem and get things to settle down. However, sometimes people say, well, I don't want to be on those types of medications. What else can I do? Integrative medicine looks at how the body functions, looks at the biochemistry of the body and where the biochemistry isn't functioning properly. So we can look at different types of vitamins, mineral, and nutrient deficiencies that may be part of the problem. I love to use the example of, why do people have a sleep disorder? So you have difficult sleeping at night, you go to your doctor, and the doctor may say, okay, try all these other things. You try these things, you're still not able to sleep well, and he'll give you an Ambien. The Ambien works for a couple of weeks and then stops working. Or you have side effects off the Ambien. The Ambien doesn't make you sleep because your body has an Ambien deficiency. The Ambien makes you sleep because it tricks the brain to kind of turn off those hyperactive centers. What's actually happening is you probably have a serotonin or a melatonin deficiency that's causing your brain to not be able to turn off. So if we were to supplement that, we gave you high quality melatonin, we gave you serotonin, we gave you different neurotransmitters, vitamins, minerals, or nutrients to try to get that biochemistry to work better, your body would feel better. So when it comes to inflammation, which is really the root of all evil when it comes to pain, inflammation is in arthritis, inflammation is in sciatica, inflammation is in the gut, it's in the brain, it's in the heart. So inflammation plagues our body in every capacity that's possible. We have different biomarkers that we can check, blood tests that we can check to see where we are on inflammation and how we trend or track that. We also can look at something called heart rate variability, which looks at how our body responds between parasympathetic and sympathetic tone. So that is the autonomic nervous system. Our sympathetic system is our fight or flight. So that's what really gets us revved up when we're in danger. And our parasympathetic system tells us to calm down. That's our rest and digest function. So we want that to be in balance. And unfortunately, when there's inflammation and or pain, that system is significantly out of whack. It's off balance. So we want to figure out ways to get that parasympathetic tone to improve. So how do we get parasympathetic tone to improve? Well, we can practice mindfulness, we can practice meditation, we can try omega-3 fatty acids to decrease inflammation, we can use an anti-inflammatory diet to decrease what we're taking into our bodies that cause inflammation. These are some simple models or simple ways to try to get that parasympathetic tone to improve. And then we can check the heart rate variability again in 6 months to see how that's trending and how that's working. So this is an example of how integrative medicine helps us manage pain in a traditional model, is what I think separates us from other practices. We want to look at the whole body. We recognize that it's not just as simple as saying you have X and we're going to do this for every single person. We have to individualize care, and that's where this comprehensive approach really comes into play. Now, we could also use regenerative medicine to help decrease inflammation and promote healing. Some people say, I've tried cortisone shots forever, whether it's in my joint or my spine, and it just doesn't work. That could be that the underlying problem, the underlying inflammation has gotten so bad that the cortisone itself will not help. So what else can we do? Well, we can use something called PRP, platelet-rich plasma, which is really your own blood that we spin down, and we inject the platelet-rich plasma back into the body parts that are causing problems, with the hopes of having the body then use its own regenerative factors to promote healing and decreasing inflammation. And if that doesn't work or give us the type of relief we need, then we can use something called exosomes. So exosomes are little stem cell derivatives that have no DNA in them. They have microRNA that can help reprogram and help focus on target cells that are promoting inflammation to help decrease inflammation and improve functionality. And exosomes can be injected intravenously, or they can be injected into the site of pain. So we have some very nice newer modalities that can help integrate and also augment what we've done in the past. I think it's important to be able to combine these therapies, give people options, because it's not one size fits all. Every body is different. Every treatment plan needs to be individualized, and we want to give patients the options to choose. And that's, I think the biggest change in healthcare in the last 10 years has been patients no longer see their doctors to have them tell them what to do. They come to us for us to provide a consultation, which means we give you the treatment options that we think would be appropriate for your specific conditions. And then the goal is to work with you to come up with a plan that you think makes sense. Just because I think it's going to work for you and you don't feel comfortable with it, then does not mean that's the right thing to do. The more important thing is to coming up with a treatment plan that we both agree on, that you think will be helpful and I can get behind. So our goal is to promote that type of team collaborative approach to bridging traditional medicine, regenerative medicine, and integrative medicine all together. If you have questions, please give us a call.